Welcome to the Things You Can't Unhear podcast. I'm your host, Maritza Barone. In this show, I will introduce you to ideas, concepts, and mindsets that will open your mind to a new world of well-being and personal life growth. Through eye-opening interviews, we elevate people in the world doing amazing things for humanity and share insights that will shift you to become the happiest, healthiest, kindest, and most compassionate version of you. Hello everyone, and welcome to another episode of Things You Can't Unhear. Today I've got Dr Joseph Sgroi on the show. He's an obstetrician, gynaecologist, infertility and IVF specialist here in Melbourne, Australia. And I asked Dr Joe to join the show today to talk to us as of last week we had a ban on all elective surgery, meaning fertility treatment has now been suspended due to the COVID-19 pandemic we are experiencing right now. And it's certainly been an emotional week for many people who are on their own fertility journey, as well as for doctors like Joe, who have been working with their patients to keep them informed and calm during this time. Going through IVF can be a testing time without the added uncertainty of COVID-19. My heart goes out to those who have been halted in their treatment. In this episode, we'll talk about what this halt means for patients on different parts of their fertility cycles and how we can use this time to reach for optimum health and stay positive. We will also discuss any implications for families who are currently expecting, either in early stages or late stages of their pregnancy. As emotions are running high right now, Joe is a calming and insightful voice for people who are dealing with these new restrictions coming into play for us. So, Joe, thank you for talking to us today on Things You Can't Unhear. I've actually wanted to have you on for quite a while now, but I think now's the right time to get your expertise in such a difficult situation that we're in. So welcome to the show.
Thank you.
So you're in your scrubs today. You're still working.
Yeah, we're still working. I mean, obviously, fertility treatment unfortunately stopped here in the state of Victoria and probably across Australia as well. As we move into that period of time, obviously, there's a lot of people anxious about their possibilities of conceiving for the future. But fortunately for those women who are pregnant, obviously, I've still got to care for them. That's an essential service and life goes on and, life will still come into the world.
I did want to touch on that quite significantly because it was a very emotional week last week with the ban on all elective surgery, and that meant all fertility treatment being suspended. So what does that mean for your patients? I really want to get into the nitty-gritty of it because it can affect many people in many different ways depending on where they're at in their cycle, right?
Well, that's right. I mean, obviously, there'll be a lot of women who can conceive naturally and may just need some advice from a fertility specialist around what are the things they need to do in order to optimize natural conception. Unfortunately, we can continue to do that sort of remotely using things like Zoom in order to telehealth and provide some advice to couples. So some people might be right at the start of their journey and they are still able to continue trying to conceive. And certainly there's no recommendation from any organisation here in Australia or alternatively the World Health Organization suggesting that people shouldn't conceive during this time. The unfortunate thing is those couples that are either embarking on or about to embark on fertility treatment, so IVF predominantly, those procedures have been put on hold. And for a woman and a couple that have been trying to conceive for a long period of time and to finally either be within a cycle or about to commence a cycle or alternatively, knowing that they were planning to in the next couple of months, to have that taken away for them is, been devastating for them.
It's an emotional roller coaster as it is, isn't it? Going through a fertility treatment and the ups and downs and the uncertainty and the unknowing, and to add this extra element of suspension and uncertainty is even more emotionally taxing. And I know as a doctor, you got quite emotional about it too with your patients. I can just only imagine how you felt.
Yeah, look, I mean, last week was very difficult. I spent probably three and a half hours counselling patients about the reasons why. And being a doctor, we sort of not only look at our own sphere of medicine, but we look globally and see potentially what the impact is to the nation, and particularly to our vulnerable people, those who are either immunocompromised or elderly. And look, we can understand why the government has put in place such measures, particularly with elective surgery, because there is, we do need to conserve not only our resources in terms of hardware and things like, masks, gloves, gowns, also our equipment in case it needs to be used for ventilation, but most particularly also our anaesthetists and our nurses who really, at this point in time, every single time they put someone to sleep, they're actually risking themselves in terms of infection. So, making sure that we're not doing procedures that are going to put healthcare workers in harm's way or potentially prevent other people from being cared for is particularly important. But it is difficult to balance that up when you're a woman who's been trying to conceive for a long period of time. And I suppose part of my role is imparting some of that, altruism in terms of what we're doing for the broader community.
You make some great points there, but I do want to talk about sort of how it has affected individual people. So I want to work out the process here. So if people had started a cycle and they'd started their injection phase, could they then no longer continue the embryo transfer stage? Is that how it works? Because this can be emotionally and financially taxing on a lot of people.
Yeah, so the government hasn't actually, so we had a advice given towards the latter part of last week. We're still waiting as of this current week, so the 6th of April, for formal clarification. But women who are currently in cycle, who are injecting in order to prepare for an egg collection, or alternatively, they're preparing for an intrauterine insemination, so insemination with sperm, they are continuing at this point in time.
Okay.
What we don't know is whether we've also, whether the government's suggesting a ban on an embryo transfer. So at this point in time, there's no directive on that. So we're proceeding as is. Where it really catches women, unfortunately, is those women who are about to start treatment, who haven't had their first day of their period and therefore haven't commenced medication. And those women, unfortunately, aren't proceeding with treatment.
What about the freezing of eggs? I know that's been halted as well, and everyone's in different boats when it comes to fertility, of course, but there's obviously people who are about to undergo surgery and have this last chance to freeze their eggs. Is that seen as urgent, or is that unurgent? I mean, there's so many ways to look at these things.
So I think if a woman who's got cancer and she's in the process of about to have either surgery for her cancer or alternatively commence chemotherapy for cancer treatment, where really at the end of the day, this is her last effort or last-ditch effort to be able to conserve her fertility for the future, there's no doubt that that's category one. That's got to do this right now, because otherwise, this woman won't have an opportunity for pregnancy. But unfortunately, for those women who are freezing their eggs because they're, at a position where at this point in time they're not physically, financially, emotionally ready for pregnancy, and they're wanting to preserve their fertility for the future, where there isn't a desire necessarily to become pregnant, and where really the delay of 3 or 4, we've got to be realistic, it could be up to 6 months before treatment can resume, isn't going to severely impact their chances of pregnancy for the future. Those women, unfortunately, are having to delay as well.
So, in your opinion, what should we be doing? What should we be doing in this time to sort of maximise our chances of fertility and use this time to sort of make it peak?
So I'm reminded of, when I was in 12 and my dad used to say, being a good Italian man, they always have proverbs, don't they? So, that proverb that we know that if you fail to prepare, you're prepared to fail. And I think at this point in time, we've got a wonderful opportunity to actually prepare and set the ground, or the ground stones, or, the footings for what is going to be a potentially great, end result once this is all sort of come to an end as well. So from my perspective, seeing patients now in terms of new fertility, it's all about trying to optimize natural conception. And part of that is, looking at things that couples are doing at home that potentially can improve their chances of pregnancy. So, timing of sexual intercourse, that's going to be particularly important. Making sure that even though we're in lockdown or in hibernation situations, that we're still maintaining good cardiovascular physical exercise and also a good diet. There's a lot of things that can be done. There's certainly, people who are wanting to do IVF. Well, unfortunately, we can't do anything. But, if there's, in some cases, we know that couples, the only reason they're doing IVF is because we've tried everything else beforehand and they've not achieved pregnancy and there's a delay. Some people with something called unexplained infertility will probably get pregnant during this period of time. And, I remember when I first started my training, I was reminded of a professor, and whenever he had a new couple that would come and see him with respect to fertility, and there was nothing that was glaringly obvious as to why they couldn't conceive. He had a dartboard, and on that dartboard was a map of the world. He'd grab a dart, he'd throw it at the dartboard, and he'd say, "Hey, listen, guys, that's where you need to go." And I think that was partly because he wanted them just to not think about fertility. And, at this point in time, we can't. And so my hope is that some couples will just sit there and go, well, you know what, we can't do anything at this point in time. They're resigned to the fact that it is going to take 3, 4, 5 months before they can conceive. And the hope, my hope, of course, is that they do naturally during that period of time.
Or, like you said, get their bodies in optimal health, mentally, physically, and good exercise, stress reduction,
without a doubt,
movement.
And part of that is also an integrative approach. I'm working with a traditional Chinese medicine doctor, and our plan is to actually have an integrated approach in terms of the care that we give our patients, so that there's you're not looking at it just from one perspective, you're looking at it from multiple perspectives. And then, the hope will be that, that additional support, possibly even a counsellor or a psychologist support, is what's required during this time, not only to conceive naturally, but yes, as you said before, to prepare yourself for the IVF, or to prepare yourself for fertility treatment once the bans have all lifted.
Is Chinese medicine still allowed at this time?
So again, it's difficult, isn't it? I mean, I find it really difficult as a practitioner. Yesterday I went to the supermarket, and I'm not trying to compare supermarket and medical therapy in any way, but, going to a supermarket where there were people walking around within 1.5 metres of each other, elderly people, fresh fruit and vegetable just out laid and bare, and people potentially being able to cough on that or pick it up and put it back down. I can understand that, that's an essential service, so we need the supermarkets to keep going. But, in terms of going and seeing a practitioner, whether it be a Chinese medicine therapist, whether it be a fertility specialist such as myself, we're taking huge precautions. There's only 1 or 2 people in the waiting room at any one given time. We're washing our hands and sterilising equipment in between patients. I wear a mask and I wear goggles every day, so my potential to infect people or to become infected is low. It is a disparity, and that disparity sort of, it worries me that people aren't taking it seriously on the outside and going to, the potential for them to become infected is so high. And, we can understand why the government wants people to stay at home, because it limits the infectivity rate if you've got less people engaging with other people. But the supermarkets at this point in time seem to me like a loose pin in all of this. It just seems like it's a little bit disparity. So look, clinics, physios, chiropractors, natural, I know that the Chinese medicine doctors are still doing remote telehealth as well. So there are occasions where you can have treatments done, and other occasions, obviously, where a lot of it can be done by telehealth.
You just have to sort of seek it out case by case, I think. You did talk about mental health for couples trying to conceive at the moment. How have you best, dealt with that with your clients, and what do you suggest the best practices might be for people out there at the moment?
Well, I think at this point in time, one of the things that you can actually applaud the government for is its investment in telehealth, and particularly in relation not only to GPs and specialists, but more importantly to psychologists and psychiatrists. And I think, there's nothing better at this point in time when people, and I feel for all couples and women trying to conceive. Not only is there the burden of isolation, but in addition to that, there's also the burden of constantly thinking about pregnancy. And I know that women who are trying to conceive almost think about things in 2-week cycles, from the day that they bleed to the day that they ovulate. And then that's 2 weeks, and then 2 weeks from ovulation to end pregnancy. And that can be quite exhausting for a person. So, obviously being a fertility specialist, my area and expertise is not in psychological support. So fortunately, we've got counsellors that continue to work through Melbourne IVF, who I'm affiliated with, but also external providers who can continue to provide support to people in that setting. And it is about understanding what's going on mentally in terms of their own thinking, and also then developing strategies in order to overcome that. So that's what the psychologists, the counsellors will try to do. Part of what I want to do is also reassure people that we will get all through this, and there will be brighter days ahead. Staying strong, making sure that you're resolute, being prepared for what's going to happen in the future in terms of mentally preparing and saying, yes, this is just a small little blip in the whole scheme of things, and we will get through it. That sort of mentality is what's going to end up driving success in the future.
Totally agree with you. Optimism and positivity wherever you can. What about for women who are about to give birth and in the situation where they might be fearful around, going into hospital or having an increased risk for their baby? Where is that at right now?
Well, I think let's take that as two parts. First of all, women who are newly pregnant or pregnant, and then women who are about to embark on childbirth. So there's been, a lot of the evidence that we do have with respect to pregnancy and pregnancy care and COVID-19 comes from not only China, but also Italy and the UK, and also studies that have been performed from women who, were pregnant during the time of SARS and MERS. So what we do know is that a woman is no likely to become infected whether she's pregnant or not pregnant. So that's reassuring that, you don't need to be overly fearful in terms of your own health, in terms of being infected. Of course, a woman, if she does become infected, towards the latter part of pregnancy with increasing cardiac output, so the heart working harder, decrease in changes to the respiratory system, she's not necessarily more susceptible to a severity of the disease, but it's more likely to impact her towards the latter part of pregnancy. So, we're still encouraging women who are pregnant to socially distance. If you can avoid going to places like the supermarket, then I would be avoiding places like the supermarket, and I'd be predominantly staying at home, apart from attending your antenatal visits with your obstetrician or at the hospital. There is no evidence to suggest there's an increase, for those women who are newly pregnant, no evidence to suggest that there's an increased risk of miscarriage or, most importantly, any abnormalities of the baby. So that's particularly important. And in the latter part of pregnancy, no evidence to suggest any increased risk of preterm birth, which is particularly important for women as they're getting towards the latter part of pregnancy. One of the things, and I was saying before, is that hospitals are taking this exceptionally seriously. And, every time you come into a hospital now, you are screened in terms of not only a questionnaire, but also your temperature being taken. Just this morning as I walked in, I had my temperature taken. So we're taking it very seriously here. And, in all honesty, probably the safest place you could be is in your obstetrician or your hospital, or the hospital's antenatal rooms, because we're wiping things down, we're, hand sanitizing in between patients. I'm wearing gloves for all patients and then changing them in between patients. So there's no cross contamination. And then within birth, I suppose, the safest place at this point in time, irrespective of COVID virus, to give birth is in a hospital, because should things go wrong, and we hope that nothing does, but should things go wrong in terms of the birth, then of course you've got immediate access to medical care. And I did have a discussion with a couple who were contemplating a home birth, and I said to them, look, probably everything will go fine. My only concern is that if something does go wrong and you're at home, that, the additional stress you'll place on resources in terms of our paramedics, who no doubt will be flooded with patients they need to see from a respiratory point of view, is going to be, quite significant. And you want to have timely access to care for yourself and also for your baby. So certainly the safest place to give birth is in a hospital. Of course, there are some minor changes that have happened, and that means that, that whole personability of what I like in terms of obstetric care and looking after a woman in labour, where you're looking at them and there's facial expressions and so on and so forth. Well, now I'm wearing a mask and I'm wearing goggles and I'm wearing a gown and I'm wearing gloves. So it does become very clinical. And I think that's a detraction from how the process all is. I always used to be surprised about how the Americans, whenever you see a birth in America, the doctors all gloved up or the midwives all gloved up like they're in surgery. And I find that very impersonable. But, we have to do that at this point in time in order to protect ourselves and, our ability to continue to look after women through pregnancy and also childbirth.
I think you're all doing such an amazing job, and I don't think anyone is going to forget giving birth in these days, long down the track. So, thank you again for everything that you're doing on behalf of all of the families out there that you're dealing with, all of your patients, and anyone listening today who's really gotten some great comfort from listening to you. Are there any websites or any informational portals that you can direct people to if they want to know more?
Well, I think obviously the government's got a website and also an app that you can download things with respect specifically to COVID. I think it's important to get your information from reliable sources. So, I'm trying to post stuff on a regular basis, whether it be through story or alternatively Instagram, just giving updates on specific things related to COVID. The other thing is the Royal Australian New Zealand College of Obstetricians and Gynaecologists. Their website is very good. And of course, they're putting up-to-date information on a regular basis as it changes and comes to hand. And also some reassuring information about things, like I said before, antenatal visits, also giving birth in hospitals. And I think this is not a time, obviously a maternal instinct is to protect her unborn. And so that heightened level of anxiety, not only in terms of protecting their unborn, but also in addition to that, this whole COVID thing can have impacts on terms of mental health. And so even for my pregnant patients, I'm encouraging them to engage with a psychologist if they feel that additional stress.
All right. Thank you so much for your time today, Joe. Good luck with all of your beautiful patients and parents-to-be out there that you're working with. And we hope to see you soon. I'm Maritza Barone. Thank you for listening to the Things You Can't Unhear podcast. I'd love to keep the conversation going. Let us know what you thought of this episode, and if something really profound came up for you that you want to share, let's talk about it. You can find me on Instagram at Things You Can't Unhear or on my personal page at Maritza_Barone. And if someone you know will benefit from something that was said in this show, make sure you share it with them too. If you haven't already, hit the subscribe button and keep up to date with what's next. And if you can spare a few seconds, please rate and review the show on iTunes, just so other people can find us more easily and quickly. And as always, my friends, be happy, be healthy, be conscious, and be kind.